back to All Things Home Care with Dana Arnone. It's time for Ask Dana. We've gotten lots of questions this week, so let's get right down to it. The first question we got from the community is, how do families find out what type of care they're entitled to? You know, that's a really good question. A lot of times the managed cares from Medicaid will do an assessment, and they're going to do a qualifier for your loved one that's really going to take into consideration their ADLs, which is their activities of daily living, and what they determine how many hours and how many days a week. That's through community Medicaid. But as a family, if you're looking to privately hire for your loved one, that's something that's going to be determined by the safety and the needs of your family. So lots of times families will call us up on the private pay or even on the managed care, and the minimum amount of hours that we see is usually about 3 hours a couple of days a week, all the way up to a live-in. So once again, one way of getting the evaluation is through your Medicaid and your managed care, your managed long-term care system, or private pay. That's something that you guys can determine for yourself. Second question that we've gotten is, what do you look for in a caregiver? Again, that's a personal decision for the family. When you're looking to hire a caregiver, probably the most important thing is the relationship between your parent, your loved one, and that individual providing the care. We in my office, we call it 51st dates, because it's like a blind date sometimes. You never really know how it's going to work out, and sometimes you get it right in the first time, and then a couple of times it takes a couple of different caregivers and to see how the interaction is. So when you're looking for a caregiver and you're calling an agency, the best thing to do is to tell that agency about your loved one and what their personal needs are, so that they can help look for that caregiver for you. The next question we get is, how time-consuming is it to become a personal care assistant? Well, that's a good question too. It doesn't take that long. It probably should take a little bit longer, but if you're going to become a personal care assistant, it takes about 40 hours or 7 days in order to get your certificate, and then you're ready to be working in the community. How does a person qualify to become a caregiver? Okay, well, there's different ways to become a caregiver. If you want to be a companion, that doesn't require a license. It doesn't require any schooling. Basically, it's just being a companion to someone, helping pay their bills and maybe taking them for a drive, doing some food shopping, and a little bit of domestic work. But if you're looking to become a certified home health aide or a personal care assistant, that is a licensed certificate type of program that you have to go through. As a home health aide, you are required to do about 70 hours of in-school work, and then some clinical rotation in the community. For a personal care assistant, we answered this before, it's about 40 hours and about 7 days of in-classroom. There is no any type of clinical rotation. Are caregivers mentored? Well, they're something that I work on every single day. In my office at Reliance, anybody who is a new caregiver that has just graduated from a home health aide school or a personal care attendant school, they are mentored by somebody in my office. We have a person that is with them one-on-one to help teach them how to really, even knocking at the patient's door sometimes is a little overwhelming for somebody. If they've never taken care of a person before, they don't really know what to expect. Sometimes if they're going to be entering into an individual's home for the first time, they really don't know what to expect on the other side of that door. So having a mentor, I think, should be a mandatory state thing. That's my personal opinion. But here at Reliance, we do mentor all new graduates. And that's for the safety of the caretaker as well as the safety of the patient. Our mentor, her name is Emmanuel, and she has been a godsend to all of our new aides and for our families and our patients. Next question we have is, what type of benefits is a caregiver entitled to through the union? That is a great question, and one of the selling points, I think, of Reliance, because we are an 1199 union agency. But just keep in mind, most agencies are not union. So if you're looking for union agency or union benefits, what you should expect, especially through 1199, is you will get full health care benefits. You will get PTO, which is paid time off, depending upon if you're on Long Island or in the boroughs. Your PTO varies sometimes. You're going to get time and a half or double time on the holiday, again, depending upon where you're working. You can be entitled to tuition reimbursement, which I think is a great thing, so that if you're entering into the field of home health care and you're looking to promote yourself or maybe go on to become an LPN, a CNA, maybe a registered nurse, Joining a union agency will have that benefit for you so that you can move on in your career. So one of the things you should do if you're calling looking for a job and the union is important to you, make that phone call when you're talking to recruiters and ask if that agency is a union agency. So those are all the questions we have for today. Please send me any questions that you may have to info@allthingshomecare.org.